Hello, my name is Daisie Flores, and my intervention is based on assertive community treatment for mental health. The category of my capstone is based on research, and a little introduction is that homelessness is a perplexing issue in America at this moment and is a major public health problem. There are many reasons as to why individuals become homeless, but the main factor that will be addressed is mental health. Poor mental health is a significant factor, with 5% of adults 18 or older experience a mental illness in any 1 year, equivalent to 43.8 million people. Mental Health First 2019. This project describes the implementation and evaluation of a unique solution, assertive community treatment. The main purpose and ultimate goal of assertive community treatment is to decrease outcomes and reduce the risk of homelessness by reducing the rates of untreated mental illness. There are many reasons as to why an individual and families become homeless. I'll be explaining 4 determinants and factors that are the leading causes of homelessness in the United States. The first determinant is individual and relational factors. California's public mental health system did a study with individuals who suffer from mental illness and found that 15% were homeless at least once in a 1-year period. The second determinant is structural factors. According to the Homelessness Policy Research Institute, researchers have estimated unemployment rates among people experiencing homelessness ranging from 57% to over 90% compared to 3.6% for the general United States population. The third determinant is personal circumstances. The University of Melbourne has found that those who have experienced homelessness cited that 62% were because of family breakdowns as the main reason for becoming homeless. The last determinant is federal government policies. According to the Coalition Eviction Prevention Program, more than 800 households each year were saved from the trauma of homelessness, keeping those individuals with a home and out of homeless shelters. The determinant that I addressed as most important and decided to do an intervention on is individual and relational factors, focusing on the main factor, mental health. Mental health is a factor that should be taken very seriously because it affects people's lives immensely. An individual's mental illness prompts intellectual and social issues that make it hard to acquire steady pay or to complete day-by-day activities in ways that would encourage stable income and housing. I will now be reviewing my interventions. So the first intervention I'll be discussing is assertive community treatment, and it helps treat individuals who have serious mental illness that interferes with individuals' lives and helps improve quality of life. ACT gives the clients assistance with basic essential skills and services like housekeeping, cooking, shopping, securing and keeping employment, transportation, and acquiring housing. The second intervention I will be discussing is eviction prevention programs, and it's a short-term financial assistance that helps individuals and families from losing their homes. Grants are given that covers individuals and families' rent, late payments, etc. Both interventions help with reducing the percentage of homelessness, but the intervention that will be addressed in my capstone is the assertive community treatment. Assertive community treatment was a route I decided to take because of how much it has reduced the percentage of mental illness. With the results of ACT, 1-year outcomes revealed 50% reductions in nights spent homeless and on the streets, emergency room visits, and nights in jail. 25% reduction in hospital days, and a 30% increase in stable housing among the ACT patients compared to controls. I will now be describing the assertive community treatment intervention. So the priority population served is all ages, genders, and races, especially those who are homeless, have any history of trauma, overlapping mental illness, etc. The delivery setting takes place in clients' homes, homeless shelters, or the streets. The type of activity is that the primary goal is to aim to reduce the symptoms of individuals who have severe mental illness and enhance quality of life. The management objectives is increasing access to assertive community treatment to reduce the risk of homelessness by treating individuals who have severe mental illness so they can get/keep stable housing. Moving on to evaluating assertive community treatment. So, process. When recruiting staff, they are required to be qualified and have expertise in their specific role. Accessible facilities. Staff goes to where the client is living at the time. So, it could be the client's homes, homeless shelters, or the streets. And culturally linguistic and situational materials. It offers treatment based on needs of client. Services are included and helps clients adjust to everyday life for when they are done with treatment. For outcome, at least 50% participants successfully complete the home finance program activities. And the finance program activities teach the clients how to budget and manage their finances. At least 50% participants successfully complete the employment skills program activities. So this includes clients doing mock interviews to prepare them for real life interviews when applying for jobs in the future. And at least 50% reduction of use of emergency such crisis care for mental health. And this helps taxpayers plus those who are in the medical field. For impact, statistically significant decrease in mental illness and reduce homelessness. Statistically significant decrease in homelessness due to mental health, and sustained increase to assertive community treatment. Mental illness affects billions of people all around the world and should be taken very seriously. This intervention will help by reducing rates of mental illness and risk of homelessness. Increasing access to assertive community treatment will encourage individuals to get the help that they need and deserve. By treating mental illness, it will enhance quality of life. Thank you for your time, and I just want to say a big thank you to Dr. Ellington for your guidance throughout this whole process.